Have you ever stopped to think about how an organization like the World Health Organization actually decides what to focus on? I mean, what's a bigger deal, fighting malaria, treating depression, or preventing traffic accidents? How do you even begin to compare those? Well, to do that, they needed a single number, a metric that could measure the impact of literally everything, from the common cold all the way up to a global pandemic. And today, that's what we're digging into. That number is called the Disability Adjusted Life Year, or DALY.
So let's just jump right in. Picture this. You are in charge of a country's entire health budget. You've got a limited pile of cash, but a basically unlimited list of health problems. You have to make some incredibly tough choices about where that money, we're talking billions of dollars, is going to do the most good. How do you choose?
It all comes down to this one simple sounding question that is, just unbelievably complex. What is the biggest health problem we're facing? Is it the one that kills the most people? Or is it the one that affects the most people? Or maybe it's the one that just causes the most day-to-day suffering. And this is where it gets really tricky. I mean, look at this. On one side, you have something like chronic back pain. It almost never kills anyone, but it can cause this immense long-term misery for millions and millions of people. On the other side, you've got the common cold. Everybody gets it, but it's pretty mild. Now, how on earth do you weigh those against something like heart disease, which is a massive killer? It really feels like you're trying to compare apples and, spaceships.
So to even start to solve this problem, big global health groups like the World Bank figured out they needed some kind of universal standard, a single metric that could basically act as a common currency for health, something that would let them compare the true impact of any health issue anywhere in the world on totally equal terms.
And that solution, which they came up with back in the early 1990s, was the DALY. It's this ambitious attempt to boil down the entire burden of any disease or injury into one single comparable number. It's a really elegant idea for sure, but as we're about to see, it's also a deeply, deeply controversial one. So what is a DALY exactly? Well, you can think of one disability-adjusted life year as one lost year of healthy life. Simple as that. The higher the DALY number for a particular disease, the greater its burden is on society. So the whole goal of public health through this lens becomes really clear. Minimize DALYs. Okay, so how do they actually calculate this thing? It's probably simpler than you might guess. The DALY is really just made up of two key parts, and once you see them, it's pretty clear how they build on each other to get to that final score. The fundamental formula is right here. DALY equals YLL plus YLD. It looks like a simple addition problem, but each of those terms, YLL and YLD, represents a completely different kind of loss. Let's take the first part, YLL. That stands for years of life lost. This is the death part of the equation. So if the average person is expected to live to be 80, but someone dies from a disease at age 50, that single death adds 30 YLLs to that disease's total burden. It's a pretty straightforward way to measure the impact of dying too early. Now, the second part is YLD, or years lived with disability. This is the sickness part, the morbidity. It's calculated by taking the number of people who have a condition, multiplying that by how long they have it, and then, and this is key, multiplying that by something called a disability weight. And this weight, this value from 0 to 1, well, this is where things start to get really complicated. And this chart is a fantastic illustration of how it all snaps together. Let's take a disease like HIV. A person's journey with the illness adds to the DALY score in different stages. First, as the disease progresses, they accumulate years lived with disability. That's the YLD. And each stage might have a different disability weight. Then, if that person unfortunately dies early, all the years they were expected to live are added as years of life lost, the YLL. The total DALY for that person's case is the sum of all that lost healthy time. The DALY was created to give policymakers this crystal clear view of the world. But you know what? Almost as soon as it was introduced back in the 90s, it got hit with a barrage of criticism from economists, anthropologists, disability activists, you name it. They all basically asked the same question. Is one single number way too simple for something as complex as human health? Okay, so the core of the criticism is this. The DALY is trying to do two different jobs at the same time. On the one hand, it's supposed to be an objective tool for measuring how big a health problem is, like a ruler. But on the other hand, it's being used as a guide for handing out money, for deciding who gets help and who doesn't. And the critics say, wait a minute, those two goals can be in direct conflict with each other. And some early critics, Anand and Hansen, pointed out this huge philosophical issue right at the center of the whole thing. If you define DALYs as a bad thing that needs to be minimized, you are, by definition, framing a year of human life, even a year lived with a disability, as a negative. And that reframing has some pretty profound ethical consequences. And this right here, this shows one of the most controversial parts of the original DALY. This curve is called age weighting, and what it did was explicitly value a year of life for a 25-year-old as more important to society than a year of life for a baby or an 80-year-old, and it was based on economic productivity. This baked-in value judgment caused an uproar, with people asking, should a health metric really get to decide whose life is worth more? And maybe the most powerful and persistent critique has come from disability advocates. Think about it. By giving a condition a disability weight, the DALY basically says that a year of life for a person with a disability is worth less than a year for someone without one. Activists make the case that their lives have equal value, period, and that any metric that even suggests otherwise is just fundamentally discriminatory. So, with this storm of ethical and technical criticism, you would think the DALY would have been thrown out years ago, right? But that is not what happened. In fact, it is more powerful and more widely used today than ever before. So the big question is, why? Well, a huge part of the answer lies in its history. The DALY is the engine that powers the Global Burden of Disease Study, or GBD. And as you can see from this timeline, the GBD has been this massive ongoing project for decades. It has basically cemented the DALY as the standard language for how we measure global health. And this map really shows you the DALY's real-world power. Visuals like this, which show the disease burden in every single country on Earth, they are all built using DALYs. They are incredibly influential, and they directly shape where billions of dollars in aid and research funding gets sent every year. But for all its flaws, the DALY also lets us see the big picture over time. And this chart is fascinating. It compares the top causes of DALYs in 1990 with 2019. Look at the left. Back in 1990, you see things like lower respiratory infections and diarrheal diseases way up at the top. Now look to the right, to 2019. They've dropped way down. And what's replaced them? Non-communicable diseases like heart disease, stroke, and diabetes. This one chart visualizes a massive shift in global health and gives us priceless information for planning for the future. So when you boil it down, the DAL hangs on for a few key reasons. First, there's just powerful institutional inertia. It's everywhere. It's also got incredibly powerful backers, the World Bank, the WHO, the Gates Foundation. Then you've got the argument that, for all its problems, nobody's really come up with a better, more comprehensive alternative. And finally, in a world that just loves data, it offers what feels like a single, objective number for making these incredibly complex and emotional decisions. Which brings us right back to that central criticism we talked about. The DALY tries to measure the size of a health problem and guide funding, all with just one number. So critics have proposed splitting those jobs. What if we had one metric that just tries to measure the burden of disease in all its human complexity, and then a totally separate one to help us decide where resources are needed most? And that's really the provocative question for the future of global health. Is it finally time for two?